Ya lo vimos cuando empezó la pandemia, la misma China revisó los datos, se vio la revisión de datos también en Nueva York, porque si llegan nuevas informaciones, no es malo revisar los datos. Ahora, debo aclarar que Brasil tiene una larga historia de reportar los datos y tiene un amplio sistema de vigilancia que recoge muchas variables, entonces, mucha información. Entonces, la revisión de los datos no es una sorpresa. Ahora, lo que nosotros sí recomendamos es que se sigan reportando los datos a todos los países, porque eso nos permite y permite a los propios gobiernos de tener una clara visión de lo que está pasando y permite a los diseñadores de políticas de planificar en dónde van a priorizar los lugares más afectados por la pandemia y también cómo podemos ayudar. El estímulo es que estimulamos a los países a que continúen reportando los datos y seguiremos trabajando con todos, pero la revisión de los datos es una prerrogativa que pueden tomar los países y se ha visto. Ahora, sí sugerimos que los datos se continúen reportando. Muchas gracias.
Gracias, doctor. Y la siguiente, estamos llegando al final de la sesión, así que gracias a todos por acompañarnos. Y la siguiente pregunta nos llegaron de varios periodistas también sobre los PPEs, de vuelta los equipos de protección personal y el oxígeno. Y en inglés preguntan, there seem to be increasing prices for needed products such as PPEs and oxygen. What is PAHO work with countries and suppliers to find that balance between price, quality, and strong supply chains? Doctora Etienne.
Thank you for this question. In fact, since January, countries around the world have struggled to gain access to the key supplies and equipment that they need to save lives, to protect healthcare workers, and to better understand the prevalence of the COVID-19 virus. In fact, there were market failures. The global markets for respirators, personal protective equipment, and lab testing supplies reeled in response to the tremendous needs and the difficulties of increasing production while at the same time observing social distancing. So in those early days, PAHO sent 27 tons containing more than 1.4 million critical PPE items to 25 countries from its own stockpile at the Regional Emergency Warehouse in Panama. We were helped by an unprecedented global supply chain that was established by WHO and other UN agencies and main international stakeholders to tackle that very challenge of supplying equitable access and delivery where they were needed. So you heard Ciro earlier. Actions are now underway to transport public health goods from Asia to Latin America and the Caribbean. And that's going to be done through PAHO's emergency warehouse in Panama. So this week, personal protective equipment will begin to arrive to this region from that source, including gloves, surgical masks, N95 masks, surgical gowns, goggles, and face shields, all of which are urgently needed in our healthcare settings. So the goods now in the pipeline may reach some 6,000 metric tons, which is worth more than $100 million. Most of these supplies are being purchased using the PAHO Strategic Fund that has enabled 12 countries to procure equipment and supplies from high quality and safety standards at a fair price. So we are especially grateful to the global support that we've received from WHO, but that global support to WHO as well, and the regional support to the Americas from important governments, Canada, Great Britain, India, and Japan, as well as the European Commission, the World Bank, and the UN Central Emergency Response Fund that provided a donation of some US $30 million to provide much needed supplies and equipment to countries in need. So we initially provided them but there has been increasing needs, and through our strategic fund and through the global supply chain task force, we are looking to help member states to procure the supplies that they very much need. Of course, we need to say that in a situation like COVID-19, access to supplies, to equipment, to treatment, and to a vaccine when that becomes available, that this is essential to allow us to respond. And it must be done within a context of equity, within a context of solidarity, ensuring that those who need it most have access to it. So thank you again for joining us, and see you next week.
Muchas gracias, doctora Etienne. Gracias a todos por haber participado en esta sesión. Recuerden que en la página web de la OPS pueden encontrar más información, así como los datos de casos y fallecimientos por país y regional. Estaremos enviando en breve las palabras de la directora y también la grabación de la sesión. Y como no hemos llegado a contestar todas sus preguntas, recuerden que pueden seguir en contacto con nosotros a través del correo electrónico, que les estaremos contestando lo antes posible. Así que gracias a todos por participar y seguimos conectados. Saludos.